So my name is Vince Matthews. I joined Briars probably around about 2018 and 19. Years ago I used to live in West Yorkshire, and so I had a dentist up there for a long time. I looked for a good dentist locally and I found Briars. I've had quite a checkered dental history, partly because I was born in the 60s and brought up in a sweet shop, so that was never going to be a good story that ended well. I think with my parents as well, years ago, dental hygiene and dentists and things like that were things to be feared of. My parents weren't particularly great at sort of encouraging dental hygiene, so I tended to avoid wherever possible going to the dentist. Consequently, over the years I've suffered for that. I'd say from my late teens into my early 20s, then my treatment of getting my teeth fixed was something that was a regular thing. Over that period of time I had an extraction of my front tooth quite early at age 16, so I had a partial denture from age 16. And then over the years I had various treatments which were invariably fillings or root canals and crowns and things like that. And primarily my problems were with my upper teeth and my bottom teeth. Whilst I did have some fillings, they didn't suffer quite as bad. But I coped. But increasingly over the years I wasn't happy with my smile, and also my teeth were starting to let me down a little bit, and I knew the crowns would come to an end at some point. So when I came down to Newbury, I knew that at some point I was going to have to make a difficult decision about what happens next. I was aware of dental implants, so I had a discussion with Nick about possibly having dental implants, and we had this sort of discussion early back in probably 2023, and it was at that point, I knew at some point that I'd probably have to go down that route, because the alternative to implants is wearing dentures, and it's something I didn't really want to have to do, because I guess it's the embarrassment of dentures and that sort of thing, and having to take them out and that side of things, which I didn't relish. So I made a conscious decision at some point, probably late 23, that I was going to probably go down the journey of dental implants. So I had a detailed discussion with Nick what that would involve, and eventually I plucked up courage. I decided at the start of 2025 I'd go down the route of having dental implants put in the top of my teeth. In simple terms, I guess it's essentially 4 single implants in your top jaw, placed at different points to give you that stability, with the implant bridge. Well, first and foremost, I had to establish whether I was suitable for implants, so you have to have scans just to make sure that you've got your bone is sufficient to hold an implant. So it was to go through that process first and have that assessment done. So that was the first point. And obviously, once I'd established with Nick that I was a candidate for implants, it was really about what the process was thereafter. Because there is a process, and it's a journey, and it's not always an easy journey, but it's a journey I feel now, having gone through it, it was definitely worthwhile, because I'm now happy with the smile I've got. I wasn't before. So it involves a process initially of extraction of the teeth that you have having removed. I was terrified of that process at the time, and I did put that process off because of my fear of sort of dental work. But that process actually wasn't anywhere near as bad as I sort of anticipated it to be, because Nick did a good job in looking after me. So I had my teeth extracted, and there was a period of healing after that. From the process of extraction, I wore an immediate denture on the day, so I didn't leave here without teeth. I left here with a sort of a removable denture, and that takes a little getting used to, because it's something completely new. Yeah, I mean that's for me a deal break. I couldn't face that thought of not having to walk away and then go away and heal without some, because it's you've got to walk around and live in the real world, and you don't want to do that without any teeth. So immediately afterwards, you've got the process of dealing with the challenges of eating food, because you have to eat soft food for a period for your gums to get used to what's happened. So there's that process, and that was again a challenge, but I got through that. That was a period of about 12 weeks, and then after the 12 weeks came back in to see Nick, just to see how things were healing and that sort of thing. And then it was a process of getting him booked in for my implant surgery, which was, I'd say, about 12 to 14 weeks after the initial extraction process. At that point, I had the implants put in, and then I was given an immediate bridge, so it was fixed in. So what was different to before was when I had the extractions and the denture was removable, but when I had the implants put in, the actual bridge in my mouth was permanent. But then you have to go through a process of healing, because you've got these implants in your jaw and they have to heal and knit with your bone. It's a challenge, you go through, first and foremost, the first procedure obviously was the extraction process, and you are a bit sore, you're going to be when you've had that many teeth removed, so you are a little bit sore. So that healing process takes time. You've got to be patient, you have to take lots of sort of painkillers and that sort of thing for a period, and watch what you eat and be careful about what you eat. And you have to, for example, make sure that you keep your keep your mouth clean as much as you can. So using sort of saltwater rinses and things like Cortadil mouthwash to keep the area clean. I didn't have any infection during the whole process, and that was because I followed that process that Nick told me to. I was seeing this very much as the journey to get that nice smile at the end of it, and I knew that I'd have to go through that process of healing and occasional, painful days, but it wasn't unbearable. So in terms of the process, I felt very supported by Nick and the team at Briars. As I say, I got a lot of information prior to procedure, and had the procedure, and I was given sort of information of how to look after myself following the surgery, and then obviously had the follow-up meetings afterwards, just to check how the sort of healing process was going. Before I had the treatment, I guess I probably thought, what is it going to look like now with like Photoshop and all these sorts of things. I sort of uploaded a photograph of me with my current teeth, and then you can click a button, it says smile, and you've got great teeth. And I was looking at that to see what it might look like, and I was hoping that my final outcome would be something similar to the image that we're seeing in terms of this nice smile with nice teeth. And I have to say that, having been through that process, that's what I've got, so I'm very pleased with that. I've actually got a smile that I'm not embarrassed about, and I quite happily smile, albeit I'm not probably the most natural smiler, but I'm happy and confident when I smile now, which was something I didn't have before. I would say to anybody, when it comes to dental issues, there's no substitute for your real teeth and looking after those properly. So telling my younger self, I wouldn't go in the sweet shop so much and I'd look after my teeth and brush my teeth. But in terms of where I've come through this journey, I'm really glad I've been through that process, because I've now got a smile I'm really happy with. So, if you're considering, the journey of dental implants, speak to your dentist. He'll assess, your suitability for the procedure. You've got to consider the cost side of things. And it is a journey, as Nick would say, but for me, the journey is definitely a worthwhile journey, despite some of the challenges along the way, because at the end of it, I've got a smile I'm really happy with. Yeah.